This budget provides the construction of a new national hospital with grant funds from the People's Republic of China and counterpart funding from the Government of Dominica. I'm aware, Madam Speaker, of the skepticism that has been expressed and encouraged by others in recent years about the construction and operation of the new national hospital in Dominica. As usual, some said it could not be done, and it would not be done. Many who poured scorn and cold water on this initiative clearly did not understand the intricate planning process required in the building of a hospital, especially on the same site of an existing hospital in full-time operation. Right here in the region, we know, for example, that it took a particular country decades to conceptualize and finally agree on the structure and layout of the hospital facility. In another country, the planning process for and the actual refurbishment of the hospital stretched over 2 terms of an administration. In a third country, after more than 15 years under active consideration, discussions are still continuing over whether that particular hospital will be refurbished or replaced. Here in the Commonwealth of Dominica, some people expected that with a flick of a light switch, we would just set out one morning, break ground, and start to build the hospital. Madam Speaker, the process of consultation and the formulation of designs and the methodology for constructing a new hospital on the same site as the current operation was very intense and required extensive discussion and negotiation, not only with officials of the 2 governments involved, but with local, regional, and international stakeholders as well. I am pleased to announce to this House, Madam Speaker, after ensuring that all necessary surveys and designs were done, all I's were dotted, and all T's crossed, all agreements have now been signed. The groundbreaking ceremony for Dominica's new state-of-the-art National Hospital will take place on 8th August 2016. And I take this opportunity, Madam Speaker, to invite all Dominicans to attend this very important ceremony. Madam Speaker, a modern hospital will bring tremendous benefits to the people of Dominica. Our citizens will have access to top-quality, affordable health care. Residents and visitors will have greater comfort knowing that when visiting Dominica, 21st century healthcare will be readily available. There will be scope and opportunity for the pursuit of health tourism, with Dominica being able to offer first-rate healthcare services to neighboring islands in specific specialty areas. Not only would this attract new and additional revenue, but it would also benefit the vital tourism industry as well. This would serve also to reduce the number of people being referred to overseas facilities for care. The new national hospital will enhance opportunities for its use by the medical schools for the clinical rotations and will bring additional economic benefits to the country. I should point out here, however, Madam Speaker, that building a new hospital on the site of the current facility has its challenges. Clearly, we know that there will be some level of inconvenience to all special interest groups, namely to patients, healthcare professionals and other ancillary staff, visitors to the hospital, and persons providing products and services to the institution. This inconvenience will be minimized as much as possible, and I dare say will be worth the end product when we receive a modern hospital facility fit for the 3rd decade of the 21st century. This is the day that we have all prayed and hoped for, and I ask citizens and residents alike to be tolerant and patient as we seek to implement short-term arrangements for the continued conduct of business at the hospital during the months of construction.